So given that we have the same crowd, I'm assuming, as this morning, I'm not going to say too much here on this introductory slide about me. And I think we'll just go into the learning objectives again. So I like to start with these, but not the formal ones. I just like to give you an overview of what we're going to cover so you know where we're going. I'll be discussing, obviously, the concepts of conflict and resolution and defining these. Why is it important, meaningful, relevant, especially, again, to us as case managers, talking about prevalence, the outcomes, the opportunities, the benefits, the pros, the cons of well-managed conflict versus not, conflict that's not well-managed. Talk a little bit about the ways we communicate, challenges we face, some of the hindrances, and of course, ways, strategies, approaches to effectively managing and resolving conflict. So we will, I know I said this last time, so if you remember, I like to start with definitions, what are we talking about here? And then we can kind of dissect it a little further. So that's what we'll start with. So defining conflict, I think we know what that is, right? I have a couple definitions up here. It's a disagreement. It's between people or parties where there's an opposing opinion or an opposing principle and so on. And I like the second definition on this slide because it speaks to when there's conflict, by definition, it comes with some sort of mental or emotional challenge or struggle. It's not just the situation itself. Again, it's how we experience the situation, right? And it speaks to this perceived or sometimes real incompatibility between individuals or parties, needs, wishes, demands, desires, beliefs, and so on. So then what is conflict resolution? It is, of course, how we resolve these things, how we find a peaceful solution to a conflict, the methods, the processes we use to help us get to this point. And I remember, in kind of developing and going through this presentation that I've given before, it really, made me think that I don't believe that we think about these methods or processes that often. As I spoke about in the last seminar, a lot of things that we do, we learn how to do them or starting early in life. And sometimes we make changes, but we have this way of doing things, right? Way of behaving, way of thinking, way of acting. And when it comes to conflict that arises, I don't know how many times it's like, we're sitting and going, oh, hey, this is a conflict. Okay, let's go through my resolution process and work step by step. And it's not that it needs to be that formal, but I think what I'm talking about here today is putting thought and intention into the ways we resolve conflict instead of acting or reacting out of habit or, impulse and so on. So I'm going to go next to the why. And as you remember, maybe from the last session, I like to start my presentations talking about why this topic matters. And you may have some ideas of why it matters. There's some obvious ones. But, the thing that stands out to me and why is conflict resolution important is the opportunity, the benefit that lies within conflict. And I know that might sound kind of funny or like it doesn't make sense, but when we can resolve a conflict in an efficient, effective manner, there is opportunity. And I love this little quote. Here's another little quote for me. And this one's from Einstein, actually. And he says, in the middle of every difficulty lies opportunity. And that really struck me as being relevant here, because when we can work through a conflict, especially in a clinical sense, right, it can lead to opportunities such as positive outcomes, opportunity for creation, for innovation, for connection, bonding and growth of relationships, whether personal or professional. It can lead to an opportunity for personal growth, for learning, for empowerment, empowering the other person and self-empowering. It can lead to an opportunity for cohesion. There's really endless opportunities that exist within some of these challenges. So it's kind of flipping how you view conflict, not as this negative thing we have to deal with, but as like, okay, there's this conflict here. I wonder what can come out of it. I wonder what growth or change might arise out of this. And of course, conflict is so important and necessary to talk about, because whether we like it or not, it's inevitable, right? It is really, we can't avoid it. It's part of life and it's everywhere. It's just part of what it means to be human. So as humans, we share this planet with quite a few other people and we have to find a way to work together side by side. And we're social creatures, by nature. So we are wired for connection with one another. And often, as you'll see throughout history, we need each other to survive. We rely on one another in different circumstances, yet we're all different. And so there's bound to be conflict and various and differing opinions. So it's everywhere, it's in our personal lives with friends, families. And on a larger level, we can face conflict in the community. Neighbors, neighborhoods, maybe with our internet provider, with maybe at the grocery store, our school districts, teachers, cities, towns, and so on. And I think this is maybe something even we're seeing for sure, if not have experienced with the pandemic, and also in these last couple of years with really a divided political environment. We're seeing an increase in these types of conflict, which I'll talk about a little bit later. But I think what's most relevant here, obviously, is the conflict that you might face at work. And in your role as a case manager, frequently there's a lot on your plate, right? And in case management, we're often dealing with multiple parties. And sometimes, maybe often, these parties have various interests, various specialties, various beliefs and backgrounds and principles. And this can be patients or colleagues, patient families, insurance companies, physicians, guardians, conservators, pharmacies, therapists, hospitals, so on and so on and so on, right? The list goes on. And as a case manager, I think we often find ourselves as the middleman or middlewoman, or the point person between all these entities, and are faced with the sometimes challenging job of helping facilitate communication, understanding, negotiation between them. To get people to kind of, see the perspectives of others and to be able to advocate and work towards resolution. So in the context of work, it can be any combination of this, right? There can be conflict between your client and fill in the blank, the clinician, the client's family, the provider, between professionals and fill in the blank, the pharmacy, the client, between colleagues, payer source, family, and so on. There's these kind of endless possibilities of where conflict can arise. And I think I bring that up because the consequences of how that conflict is managed or resolved is really impactful and meaningful. And this is where I want to stop for a second and just turn and talk about the pandemic, right? The elephant in the room, of course, or maybe it's not even an elephant anymore. But talking about, conflict is relevant in what we're facing right now. Like I said, we're seeing it in the community. Maybe we're experiencing more conflict ourselves at home, in our families, with friends, community, at work, and so on. And, it reminds me, again, I've been talking a lot lately and presenting on pandemic-related trauma, fatigue, and stress to nurses and case managers and public healthcare employees and all different types of clinicians about these things, about how to deal with this and what it means. And, what has stood out, like I said before, is just this chaos and insecurity and unpredictability that has come with the pandemic, and loss too, right? Loss in so many forms, and change. And when this is all happening, people are stressed and they feel insecure, right? And when people feel insecure, we begin to grasp for things to hold on to, for security. And we can get strong emotions, strong reactions, strong feelings when we're in this state. And when we're stressed, that of course impacts how we feel, right? Stress is internal reactions, like I said, and this is going to impact our nervous system. Maybe it gets dysregulated, maybe we're hypervigilant. It can impact our ability to function as well. One notable thing is, stress's impact on our brain. So our prefrontal cortex, which is the front part of the frontal lobe here, is in charge of a whole bunch of important things, right? Like decision-making, impulse control, emotional regulation, planning, judgment. Those are all housed up here. And what research shows us is that the prefrontal cortex is really, really vulnerable to the effects of stress, even small stressors. So that becomes problematic, right? Because if this part of the brain isn't functioning as well, when we're feeling stress, we're more likely to react out of impulse or emotion versus being able to use this part of our brain that can say, that has judgment and planning and impulse control. So I think the pandemic, this is what we're seeing, are these reactions, right? And maybe this is also fueling or feeding conflict and making a little bit more difficult to solve. And on top of the other circumstances, lack of resources, right? There's a lot that comes with this pandemic. So now that I've reminded you, and I'm sorry for doing so, how prevalent relevant conflict is, especially right now, the truth is we have two choices, right? We can accept that conflict happens and learn to deal with it effectively and be intentional about how we go about that, or not, or we don't. We can choose. And I think it's good to know the consequences and impacts of these choices. And, some of them are obvious and some of them, but bringing these to the forefront of your mind can be helpful. And again, intentionally and consciously, because that's our ethical duty and responsibility, right? As clinicians, is to think things through. Like, what are the consequences of how I'm going to go about interacting in this particular situation, in this conflict between whomever, or resolving something, or advocating, or creating cohesion. So, again, I don't think we always sit down and think through how we respond. Often it's a reaction out of habit or impulse or subconsciously. And then additionally, sometimes it can be hard to just jump into conflict. I don't know if anyone's experienced this. I know I have, sure, in life, where there's times where you're like, I don't want to get in that. And, sometimes it's fear. Sometimes it's fear of confrontation, fear of the outcome, fear of speaking up. Sometimes we react out of anger or false assumptions. Other challenges, we can feel helpless or fatigued or hopeless. We might feel like, what does it matter anyways? I can't make any change anyways, or we don't see a solution. So we may tell ourselves like, yeah, forget it. I'm just going to avoid this one, or it's not worth it, or it's too much energy. But, whatever the reason may be, intentional or not, subconscious or not, when conflict goes unresolved, or it's poorly managed, or it's avoided, there are definitely impacts of that, right? So I talked about the positive impacts already, but the predictable negative impacts we see are obviously poor outcomes, and then hurt relationships, damaged relationships, which I think is one of the biggest impacts that is most important. Because when you think about our role and jobs as clinicians and case managers, it is that relationship, right? We are there to build a relationship, a professional relationship with our client, with that team, in order to promote change, healing, growth, good outcomes, whatever specifically that looks like in your role. That's why we do this work, right? That's important to us. We want to help. And when we don't manage conflict well, or we avoid it or whatever, we're hurting that. We can, there may be resentment. What we see when conflict isn't managed well is that one or both parties tend to have a lower level of motivation or enthusiasm to work together in the future, or to work towards goals. There can be, resentment, burned bridges. It can lead to further or ongoing dysfunctional communication, maybe being passive or aggressive, or passive aggressive, definitely misunderstandings, and overall leads to division instead of cohesion, which is what we're trying to do. And especially as case managers, I see, visually as being like this point person between all these different entities, and you're trying to connect them all in a way that promotes a common goal, which is often difficult. So a huge part of resolving conflict is communication, how we communicate, what we communicate, and there's lots of ways we communicate with each other, right? And these have changed over time, but there's verbal, written, there's technology, emails, texts. We communicate through images, through emojis. Sometimes we see communication through documentation notes, and things can get lost when that happens at times, right? Each type of communication comes with its pros and cons, barriers, challenges, benefits. And then I think it varies by the individual, right? Some people prefer certain types of communication, and that can be a bit of a barrier too. I know I have lots of friends who don't want to talk on the phone, but they just want to text, or they don't want to text and they just want to talk on the phone because it's just their style. And so you're dealing with multiple styles of communication and trying to create cohesion with that. And, frequently a big part of communication is nonverbal as well, right? And what we know about nonverbal communication, which I thought this was a really interesting statistic. So what research tells us is that when it comes to communicating, only about 10% of our communication is verbal. 10% is the words we're using. And the other 90% of how we communicate is nonverbal. So even though we think we might be expressing everything through talking to someone, what the message we're sending and the message the person is receiving, data research shows us, is what else we're doing. So it's our body language, it is our tone of voice, our affect, it's our posture, our facial expressions, any movements or gestures, our eye contact, how we take up space or don't take up space. It can involve touch. All of these things send messages, right? They're ways we communicate that we don't always think about. And problems can arise when there's inconsistencies between our verbal communication, what we're saying, and our nonverbal communication, all that other stuff I just mentioned. So if I say, to someone how are you doing today? Versus, how are you doing today? You can feel the difference in those statements, right? The words are the same, but there's so much that's different about the nonverbal communication, and it's really a different message, right? The second one drives disconnection. It doesn't show empathy, whereas the first one drives connection. So I'll talk more about those specific factors in a little bit. So we've likely heard of these different types of communication. There's assertive, there's passive aggressive, there's aggressive. And obviously the goal here is to be assertive. And, I think one thing to be said about assertive communication is that it's important to be hypervigilant or aware of what this looks like and what you're doing, because it's not that you don't know these things. I think it's our awareness of what our habits and responses and reactions are, or the ways that we communicate, because often it's a pattern, right? We've learned to communicate and we kind of use the same way throughout life, unless we're intentional about changing it. So for example, if someone has always been passive, doesn't really speak up for themselves, doesn't speak loud, maybe doesn't set boundaries well, being assertive may feel like being mean or rude for that person, whereas it's not. And so being aware of okay, I can be direct and clear, and as long as I'm appropriate and respectful of others and myself, then that's not rude or mean. That's just what assertiveness looks like. And on the other end, if someone's used to communicating in a passive aggressive way or an aggressive way, you may believe yeah, I'm just saying how I feel, or I'm expressing myself, but really examining am I being honest while still being direct? Am I being respectful of others and control of myself, but not controlling of other people? So really paying attention to these qualities, is this something I'm doing? Because what we know about assertive communication is that it fosters connection and it fosters growth and change, which again, as clinicians, I think that I don't want to speak for everyone, but I think this is why we do these things, right? This is why we are in the helping professions, because this is what we care about. It's meaningful to us to help people, to promote change and growth, whatever that may look like in your role, in your field. And we do that through, having this solid, honest, open, appropriate, clear trusting relationship with somebody, and using assertive communication is a big piece of that. So, let me move to the next slide here. Okay, so this is on the other side, what poor communication looks like, right? It's just the opposite of assertive communication. So when it's unclear or confusing or inattentive or avoidant and so on. And I wanted to include this slide. This is another one that is, what the different styles of communication look like. You can see the consequences of these things. So I'm not going to read them all. You have them in your handouts, but I wanted to include them for you. So now I'm going to move into personalization and talking about really what I'm talking about here are some barriers and challenges when communicating and when we're trying to resolve conflict. And I mentioned a few of them before earlier, the way we communicate, inconsistencies in communication are some challenges. But the next one I want to talk about is personalization, meaning when we take something personal or when we internalize a message or a situation. That's what I mean by personalizing it. So, for example, not professionally, but just in our regular personal lives, if someone doesn't call us back and we jump to the conclusion or assume or believe that it means that, well, they don't like me, or they don't care about my needs, or they don't care about my feelings. That is an example of personalizing something, because you're taking the situation, the circumstance, and assuming that it has something to do with you, your worth, your value, and that's triggering, right? And if something's triggering, it brings up emotions for us. And as I discussed before, when emotions come up, it's hard to keep the rational brain online. Professionally, an example might be, if you're at work and you really wanted to work on this project and you requested to be on this project or this team, and then you don't get chosen. Personalizing might look like, they didn't choose me because I'm not good enough, or they don't care about me, or something like that. So part of it's jumping to a conclusion about what that context means, the situation means. And then the second part is like believing it means something about you personally. So a situation can have something to do with you, but it's more about your belief about its reflection of your worth or your abilities or you as a person. So when we personalize something, we can't detach from it in a rational way. We can't remain calm because, again, when we believe it's about our worth or who we are, our abilities, it's going to bring emotions up for us, and we're going to feel reactive instead of being able to use logic. So on the other hand, being rationally detached, or rational detachment, means having the ability to be aware of, to acknowledge, to manage how we feel. And when we can manage how we feel and our beliefs, then, our behaviors, our reactions are also better managed. So we're not personalizing something. We're removing ourself, our judgments about the situation, and it becomes like less hot, less reactive, right? And we can see more clearly how to handle it. But when we're not rationally detached, our emotions are just really tied up in the situation, into what's happening. And again, when that emotional part of our brain turns on, that amygdala, it can flood the rest of our brain, and we can have a hard time detaching and making good decisions and being able to work through conflict in a way that's not, objective versus subjective. So, I think one of the things, kind of talking about what can happen, what can go wrong when we are not able to rationally detach, when we are taking something personal, when we feel emotionally overwhelmed and kind of out of control or triggered by a situation or a conflict. One of the things we tend to do as humans is to blame other people. And blame rarely has a good outcome, whether we're blaming ourselves or someone else. So on this topic, I want to share this short animated video clip with you, and it's from Brené Brown, who's, in my opinion, an excellent researcher. She's a speaker, topics of like connection, emotions, empathy, shame. And I don't want to say too much beforehand, just that she's going to talk about blame. And I want you to think about it in the context of conflict. So I'm going to play this video, and if you could let me know if you can't hear it or if it's not working. Otherwise, I'm just going to go ahead and let it play and turn the volume up. Oops.
All good.
How many of you are blamers? How many of you, when something goes wrong, the first thing you want to know is whose fault it is? Hi, my name is Brene. I am a blamer. Let me just tell you this quick story. So this is a couple years ago when I first realized the magnitude to which I blame. I'm in my house. I have on white slacks and a pink sweater set, and I'm drinking a cup of coffee in my kitchen. It's a full cup of coffee. I drop it on the tile floor. It goes into a million pieces, splashes up all over me. And the first, a millisecond after it hit the floor, right out of my mouth is this: damn you, Steve. Who's my husband? Because let me tell you how fast this works for me. So Steve plays water polo with a group of friends. And the night before, he went to go play water polo. And I said, hey, make sure you come back at 10, because I can never fall asleep until you're home. And he got back like at 10:30. And so I went to bed a little bit later than I thought. Ergo, my second cup of coffee that I probably would not be having had he come home when we discussed. Therefore, and so the rest of that story is I'm cleaning up the kitchen. Steve calls, caller ID. I'm like, hey. He's like, hey, what's going on, babe? What's going on? So I'll tell you exactly what's going on. I'm cleaning up the coffee that spilled all, like dial tone. Because he knows. How many of you go to that place when something bad happens, the first thing you want to know is whose fault is it? I'd rather it be my fault than no one's fault. Because why? Why? Because it gives us some semblance of control. But here, if you enjoy blaming, this is where you should stick your fingers in your ear and do the na thing, because I'm getting ready to ruin it for you. Because here's what we know from the research. Blame is simply the discharging of discomfort and pain. It has an inverse relationship with accountability. Accountability, by definition, is a vulnerable process. It means me calling you and saying, hey, my feelings were really hurt about this, and talking. It's not blaming. Blaming is simply a way that we discharge anger. People who blame a lot seldom have the tenacity and grit to actually hold people accountable, because we expend all of our energy raging for 15 seconds and figuring out whose fault something is. And blaming is very corrosive in relationships, and it's one of the reasons we miss our opportunities for empathy. Because when something happens and we're hearing a story, we're not really listening. We're in the place where I was, making the connections as quickly as we can about whose fault something was.
Okay, so I just love her as a speaker, but what stands out to me here in regards to this topic is when we feel uncomfortable and have these uncomfortable feelings, fear, anger, disappointment, sadness, whatever it might be, we often turn to blame because we're trying to discharge this discomfort we have onto someone else or onto something, and trying to gain some sense of control, like she said, where we don't feel any. But blame doesn't solve the problem, right? It often makes it worse. It can feed conflict. And I love what she says, blame has an inverse relationship with accountability. Blaming is corrosive to relationships. And it's one of the reasons we miss opportunities for empathy. And I think miss opportunities for resolution and growth. And again, for building relationships, which is why we do what we do, right? That's our goal. So a quick story I'm going to tell you that's kind of relative to this. Last time I presented on this topic and showed this video, it was in October, and I was presenting to another group of case managers locally here in Detroit. And it was right before Halloween. So I had just watched this video, reviewed it, had this concept of blame in my head. And it was a few days before my presentation. I was at home in the evening with my son, who's 8. And there's this thing they do around Halloween called booing people. I don't know if you've heard of this, but basically you leave a gift basket of Halloween goodies on your neighbor's porch with a little sign that says you've been booed, and then they pass it on to other neighbors. But you're supposed to do it secretly, not tell anyone, not get caught doing this drop-off thing, this booing. So I'm with my son in the car, this concept fresh in my head. And we're all excited to go boo this neighbor. And I pull up in my car real slow and kind of turn around the corner and turn my headlights off and try to hide out of view. And my son runs up to the door, and unfortunately he gets caught, right? He gets busted. The neighbor sees him dropping it off on the porch, and he's so disappointed. You know, he's upset because he did not want to get caught. He wanted this to be a good surprise. So he runs back to the car, and the first words out of his mouth is, "Mom, if you just would have been quieter, and you shouldn't have parked there, and you didn't turn the lights off in time," and all this blame was coming out. And instinctually, I felt it instantly, like rising up in me. I felt attacked, and I was ready to say, you know, something like, "You know what?" But in that moment, because I was aware and I just watched this, I recognized what was happening. He was blaming because he felt out of control and really upset. And when I could see that, I was able to breathe and reframe the situation and tell myself and understand that he's upset with the situation and he's trying to discharge this energy. And so in that moment, instead of reacting like I probably would have previously, I empathized with him and I said, "Buddy, I know you're really disappointed about them seeing you. I know you're mad. I know you didn't want it to be this way. That was really frustrating. I know you're sad about it." And I, again, showed empathy. And in that I realized rationally detaching myself from the situation. Whereas my initial reaction was anger, like he's blaming me. This is about me. I could reframe it, detach from it emotionally and go, this situation, even though he's telling me it's about me, it's not about me, right? And I could think and react rationally instead of emotionally. So I thought that was an interesting example of that. So with that being said, we'll move in now to the, the tools, the skills, the approaches that we can use, the resolutions part of promoting resolution, cohesion, communication. And one of the first things I like to talk about is what's called the LEAN model. And I do like acronyms. They're easier to remember, I think. So it's LEEN. And the first L of the LEAN model is listening. So listening is really, of course, one of the most important parts of communication, but unfortunately can easily slip away from us. Even as I was watching that video with Brene Brown, one of the things that stood out to me is saying, like, when we're reacting out of emotion and we're in this place of like wanting to blame, we're not really hearing anyone else. We're more concerned about what we want to say to defend ourselves or to blame someone else or to figure out whose fault it is. And another quote for you here. Oh, wait a minute. I think I got these out of order. Here's a little quote. So this is, I like this quote, although I hope it's not true. I don't want to say most people, but it does happen often. So it says, most people don't listen with the intent to understand. They listen with the intent to reply. And again, I think sometimes we can get so worked up, and I know it's human, right? I've caught myself doing this before, where we're not really listening to the person. It's like that difference between hearing someone and listening to them, where we can get too worked up in like what we want to say next. And I think the consequences of doing this are really impactful. Again, being aware of this, aware of, are you listening and being attentive in the moment, or are you waiting to say something next? Because if we're just waiting to say something next, often the other person can tell, right? And that can feel invalidating to them, like we don't really care what they have to say. It doesn't support empathy. And I think there's a lot lost. There's so many times, and I have to say, like, I'm a talker, which I have to balance, right? Because I enjoy talking, I like talking, I think I have good things to say sometimes, but I have to balance that with listening, because when I don't, there's so much of the conversation lost that I could have learned from or gained from if I'm just the one talking, right? So what does good listening look like? Go back to this slide here. Of course, being present, being an active listener. So being an active listener kind of encompasses a bunch of things, but it's really engaging your whole being, your whole self in the communication and in the listening process. So you're engaging actively your body language, so that might look like nodding or facing the person versus facing a different way, right? Eye contact is another part of engagement. Just showing the person that you're present with them, that you're there in the conversation. Because when you do that, and you don't say, I'm present here with you, you just show that, and the person understands and feels it. What they feel from you is that you care what I'm saying, you're present with me, this is important to you. And again, what that's going to do is influence a good quality therapeutic relationship. It's going to help you work towards cohesion, and it's going to help you work towards resolution, which ultimately leads to hopefully good outcomes for the whole process. So other things you can do with listening are listening to what's said, but then also reflecting back and summarizing what you just heard. And I'm going to talk about those a little bit later when I talk about motivational interviewing. And another really great thing that we can do that helps us, it supports both sides really, meaning the other person feels better, heard and understood and knows that you care, but it also helps us gain more information and understanding is this, asking clarifying questions. So what this looks like is just like it says, you're asking questions out there to understand what's going on. That might look like, what do you mean? Or can you explain that a little more? Or can you tell me more about that? Or I think this is what you're saying, am I right? Like checking in with that. And so it gives you the opportunity to gain insight into what's happening, and also sometimes gives the other party to gain their own insight. Because when you're asking the question, you're kind of forcing in a way them to clarify what they mean. And that can bring clarity on both ends or new insights. And I can't tell you how many times in my head, I had this assumption of like someone says something and I think I know for sure what that means. And then I go, no, I'm going to ask. And I ask and I'm wrong. And it's something I would have never even thought of. And then I'm so glad that I asked. So with clients, especially, I always ask, because ethically, I think that is our responsibility and role. Even if I am afraid it might sound stupid, sometimes I premise it with like, I don't want you to think I don't hear you. It's really important to me that I really know and understand what you're saying. What I think I heard you say was this, is that right? And then the client has the opportunity to go, yes, that's exactly it. And then they feel validated, or they tell you, no, that's not it at all. And then you both learn something, right? So asking those clarifying questions is really, really important. Moving to the next letter in the lean model, which is E, or empathy. So empathizing with the person or people or parties that you're dealing with. This seems maybe like an obvious one. Empathy is non-judgment, considering another person's perspective. But I really think the best way that I can show this to you is to show you this next little video. And this actually is Brene Brown again. This is under 3 minutes, and she has this great explanation of empathy that I'm going to play. It's another little animated clip, and then I'll talk a bit about it afterwards. So I'm going to play it. Let me know if there's any issues. Otherwise, we'll just proceed. Okay, here we go.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay. I love that. Empathy fuels connection and sympathy drives disconnection. And what do we want, right? What has the best outcomes? What is our responsibility and role as a clinician? What has the best opportunities for growth, cohesion, resolution, progress, all those good things I mentioned earlier. And I think empathy is a big part of it, right? It has that opportunity within it. And empathy is sometimes words, and it's sometimes nonverbal communication, right? It's your actions, how you treat someone, being attentive, being present, being non-judgmental. I just love her description of this. And I think when people feel that your empathy versus sympathy, when people feel connected, conflict and disagreement is so much easier to resolve and manage, because both sides are feeling that, like, compassion, respect, non-judgment, even if they don't agree, and are then more willing to work towards a resolution. So I threw this slide in here too, because I liked those 4 characteristics she listed from Teresa Wiseman, the nursing scholar, of what empathy is: perspective taking, non-judgment. I have perspective taking twice. The third one, I think, is recognizing emotion in other people. And then the 4th one is communicating that. So these are repetitive, but all the info's in there. Okay, so moving to the next letter in the lean model is E. And I talked about this a little bit already, right? It's explaining, which is communicating, and doing so calmly. And I would add assertively. And we talked about assertive communication, what that looks like, and the importance of being aware of the way that we are communicating and asking ourselves, am I being direct? Am I being forthcoming? Am I being clear? Am I being honest? Am I advocating? Am I for myself, for my client, for wherever is appropriate? And then the calm part, I think, speaks a lot to the rational detachment, which we spoke about before. Being able to remove your beliefs about yourself, not personalizing the situation, helps you be able to explain and communicate and negotiate in a calm manner. The next letter N here is for negotiate. So with negotiation, we're making a plan, right? And I think it's okay and beneficial even to say it like this, like, okay, let's talk, understand each other, make sure we're on the same page, and then move towards negotiation or a plan, build an agreement that is fair and balanced and realistic and appropriate. And in the end, with negotiation, each side needs to be informed, right? And comprehend the information. And of course, both sides may not love or might not be their most preferred agreement or negotiation, but at least they acknowledge, are willing to move forward with the plan and again, move forward and get it. So this next slide here speaks to rational detachment again. And you know how I feel about quotes at this point, so I just had to throw this in here. There's a huge freedom that comes when you take nothing personally. There's a book some of you may know of called The Four Agreements, and that's it kind of like rules to live by. And the first agreement is don't take anything personal. And I know that's easier said than done, but just being aware of in that moment, this isn't about me. Even when it is about me, it's not a reflection of who I am as a person. My worth, my value, my abilities can help us depersonalize situations instead of acting in a reactive way. Along with quotes, I kind of like metaphors. I think they tend to stick better in our minds. And so here's one I wanted to share with you guys that I learned. And this is the quote here. It's on the first bullet point. It says, act as a thermostat, not as a thermometer. And I'm like, oh, I kind of like that. And I first heard it when reading about parenting skills, parenting advice, and not being reactive to our children's behaviors, because as we know, kids can have all types of behaviors and emotions, and that's just what it means to be a kid. And sometimes as adults, they can be triggering to us, but we want to try to remain calm. So if you think about a thermostat, like the thermostat on your wall in the house, what does it do? Its job is to hold the temperature steady, right? It is not reactive to its environment. It holds the temperature steady of the room. Whereas a thermometer, this is a reactive thing, right? It's reactive to the environment that it's in. If it's hot around it, it heats up, it bubbles, it rises. It changes depending on what's happening around it. So not just with our kids, but in all circumstances of conflict or any circumstance, chaos, crises, whatever it might be, remembering to be a thermostat and not a thermometer. So I like to think of this, I visualize it literally. So if I'm going to walk into a situation that I know might be triggering, that I might be tempted to take things personal or be reactive to, if I'm using a home environment, if I'm working and I can just hear the chaos of my kids running around upstairs and I know I got to walk up there in a minute, I take a deep breath and kind of visualize this. But you can visualize it before walking into a meeting or before meeting, meeting with someone where it might be difficult or challenging. And I think of myself as like, I visualize this holding steady. I'm the thermostat in the room, regardless if all the other people around me are thermometers. I might be walking into a room full of thermometers, of reactive people with lots of emotions, but I'm going to maintain this thermostat as much as I can and kind of have this internal sense of control, kind of this, bubble around me. So I think that can be helpful to think about when we're trying to be intentional about how we interact and communicate in situations in order to, promote the best types of communication, cohesion, resolution, really. This is kind of along the lines of detaching, but really a tool and something to think about when we're communicating and when we're trying to resolve conflict. And I didn't even realize I had this many quotes in here, but I sure do. So this one says, we don't see things as they are, we see them as we are. And I like this one because I think it speaks to the fact that our life experiences, what we've been through in life, and other factors, right? Internal factors, genetics, whatever, are going to shape our perceptions of the world, of other people, of what's happening around us, of ourselves. And, we take those things in, we take in those experiences, the world around us and the knowledge that we've been exposed to, because that's all we have to go on, An example, you see this with kids a lot because they're just learning stuff. When my daughter was little, she started calling the remote control a hammer, and she would say, "Can you pass me the hammer?" And we're like, what? That's not a hammer. But she had seen us take the remote when it wasn't working and bang it like this to try to get it to work. So she deduced, based on the knowledge she had, that this was a hammer. So, it just is highlighting that example that we just know what we know. We don't know what we don't know. And part of helping facilitate empathy and good communication and resolution is being open to learning, hearing about, and considering the other perspectives of other people, and knowing that their perspective is valuable. Doesn't mean that you have to take on their belief or agree with them. It's respecting it, hearing it, acknowledging it, being open to it, validating it as their truth, in knowing that it may be vastly different from our own, and that's okay. When I think about perception, I thought about these examples that I'm sure at least some of you may have seen, and it speaks to the fact that perceptions can vary by the individual. So here's some very controversial images here. Maybe you've seen this dress on the left, this infamous dress. I will tell you right now, and I see this dress 1000% as royal blue and black. I see it as nothing else than that. I've never seen it as anything else than that. And yet other people will insist that this dress is white and gold. I even had someone tell me it's brown and something else. And this picture in the middle, right? Do you see a young lady with a feather in her hair and her head turned, or do you see an older woman with a headscarf? Or maybe you can see both. This picture on the right of the tennis shoe, this is another one that I can, I don't know if it's on your screen on the right or left, but regardless, the shoe, 100%, I see this only as teal and gray. People tell me it's pink and white. Some people agree with me. Some people will say it's pink and white. But what's interesting is that we would fight to the death arguing our side, wouldn't we? That's why I say these are controversial images, because that is what we see, that dress being black and blue for me, is 100% truly my experience. So I then believe that I must be correct. But other people, and I'm sure there's some here watching, they see that dress as different colors, and they feel the same way as I do. The question is, can both of us be right? Is there more than one truth? And I think that's what it's important to understand here, is that we have different life experiences, we have different individual characteristics, and there are more truths than just our own. And when we acknowledge that, then it's easier to compromise. And again, you're empathizing with the other person when you're not saying like, I'm right, you're wrong. It's like, I hear what you're saying. I get where you're coming from, and not trying to argue with what is their truth, just acknowledging and validating it as theirs and you having a different one. Knowing our truths aren't the only one, no matter how much it might feel this way. And I think these images really help highlight that for me. Like, I know other people see it a different way, but I feel strongly that it's this way, and kind of just shows how there can be multiple truths. So another way to think about perception, and this is more about perspective. I love this visualization. So this is a sculpture made out of wire by a French artist, and it's in Paris. So when you stand in front of it, you can see on the picture on one side, it looks like an elephant very clearly. And if you stand all the way on the other side of it, on the other side of the screen, it looks like two giraffes kind of crossing like this. And then if you look at it in the middle, it kind of looks chaotic. It doesn't really look like anything. And again, depending on where you're standing, you will insist on what this sculpture is. I would stand over here and say, this is an elephant. I would bet all my money on it. And someone over here said, absolutely not. These are two giraffes. And it's about where you're standing, right? What your experience in life has been, where your perspective is. It's not that anyone's wrong. It's that they're understanding there's multiple perspectives in different situations. And these are really important, concepts in understanding and resolving conflict. As are these next two I want to talk about, which are transference and countertransference. These are big topics, but I just wanted to mention them here. And hopefully you've heard of these before, but these are, again, really speak to being ethical in practice as clinicians and case managers, and having awareness of transference issues, and that they can and do occur. So these terms, transference, countertransference, are rooted in psychotherapy. They were initially developed by Sigmund Freud, and he realized that as human beings, we have this tendency to transfer what we know and feel and believe about one situation to situations that resemble it. So for example, if the very first time I encountered a glass, I learned, well, it holds water. I can pick it up and use it to hold liquid. So then the next time I encounter something that looks like this, I can take that information, transfer it onto it, and assume the same thing is true. And we do this with people too, because that's just the way our brains work. So for example, we may, have a client that reminds us in some way, subconsciously even, and that's where it becomes more dangerous, of something, a past experience or someone that we didn't like or that was harmful to us. This can also happen the other way around, right? Clients can transfer emotions from their past experiences onto us. So knowing that this can happen, this transfer of emotions, beliefs, thoughts of our opinions, onto a client or a client onto us, we just know what happens. The most important thing is being aware of it, being aware of our reactions, our beliefs, our feelings. So I think ethically, the most important thing is recognizing transference, that term, which is when we as the clinician are transferring our previous beliefs or attitudes or feelings from a past experience or past relationship onto our client in the moment where it doesn't belong. We have to be hypervigilant to these types of things. This can be, being just reactive because of someone's tone of voice, because of actions that they're taking or the problem they're dealing with. And if it's too involved, if it's too enmeshed, like, let me give an example. So let's say that you're a clinician and you grew up with an alcoholic father, and it was kind of traumatic. He was in your life sometimes he wasn't. You felt like you really couldn't trust him. And then because of that, you have some anger, some resentment towards your father, and really towards the whole alcoholism thing, right? So then let's say you have a client who comes in, who's an older man, who is an alcoholic. It can happen, and it can happen subconsciously, that our feelings and beliefs as the clinician in this case might be transferred onto the client. Maybe you find yourself feeling angry or resentful towards your client's alcohol use, whereas that's not appropriate in this context. And your feelings don't have anything to do with the client. They're coming from a past experience. So again, being aware of transference, and then also taking action when you need to. There are and will be times where it's not appropriate for you to work with that client because of transference issues. And you have to recognize that and make an appropriate referral to someone who is more appropriate for them and that would be a better fit. That's part of our ethical duty and responsibility. And then when countertransference happens, when a client is maybe doing that to you, it's also important to be aware of it. If you remind them of, someone that hurt them in the past, maybe it might be bringing it up to them in a way that's gentle and respectful and non-judgmental, or maybe helping them find someone who's a better fit. I mean, as a mental health clinician, that happens. For example, if I have a client who was abused by women, on multiple occasions, being a woman may make me not a good candidate to be his therapist. Maybe he needs to work with a man because he, wouldn't be able to progress well having a woman therapist because of those transference issues. And that's just is what it is. It's not bad. It's just recognizing those things so that you can help promote the best outcomes. And in the realm of conflict resolution, if we're not aware of those things, you can see how there can easily be misunderstandings and conflict and assumptions and emotions that come up that are going to skew the whole process of resolving conflict in an effective, efficient way. Okay, so going into motivational interviewing here for a minute, this is a great and useful tool. It can be and is like its own seminars. I'm sure you've seen them. But again, motivational interviewing is a collaborative, goal-oriented style of communicating with your client. And in doing so, you're paying attention to the language of change. And this can be helpful in promoting resolution because what you're doing is you're using these tools to promote communication, to promote empathy, to promote cohesion and understanding, and help get, I'll talk about the tools and tell you how it does that. So with motivational interviewing, again, there's a lot of different tools, and I have some listed here. One that I want to speak to is asking open-ended questions. So this looks like not saying, oh, you must be sad about that, or did you want to do that? Or those are questions that are just going to get you a yes, no, or or answer. Versus an open-ended question is something that can't be answered with a yes or a no. And what that does is kind of force the individual to think about, think more in depth to, or maybe they already know. It may force them to explain better what they mean. So open-ended questions look like, tell me more about that. Or what led you to that decision? Or, wow, what do you think about that? Or what do you feel about that? And this helps avoid assumptions. It can help us avoid personalizing things because we can clarify and get more information and gain insight on both sides. Another tool in motivational interviewing is using affirmations. And so this is, as it says, affirming what the other person or party is saying. And these can be short statements like, okay, I hear that you saying you don't like that option, or I hear you saying that makes you really sad, or I know it sounds like you're really frustrated about this. Just short statements that are affirming what you heard. And this promotes empathy. It promotes the fact that you're present and attentive, that you care, that you're not distracted, but you're in the conversation, which is going to promote resolution in a better fashion. Reflection is very similar. And again, you know, you're reflecting or kind of parroting back or using different words, what you just heard or what you understood to be said. This also promotes caring and empathy and helps avoid misunderstanding, assumptions, and, you know, helps you hear that person's perspective. And with reflecting, you're giving that person the opportunity to tell you if you heard right or not, you know. Okay, so what I hear you saying is that you don't like that option, but instead you'd like to do this. And they can either say, yes, you're right. Or they might say, no, that's not what I mean at all. And then gives the opportunity to clarify. Summarizing is very similar. You're, instead of reflecting back just what you heard, you're kind of summarizing or reflecting back the whole thing. I do this a lot in therapy to assist clients in saying, you know, okay, so it sounds like this is the big picture. Is that right? Attending, again, we've spoke about this. So it's being present in multiple ways. Showing the person in multiple ways that you are present and attentive and care about what's being communicated. Okay, so lastly, I just want to speak to the value of the therapeutic relationship. And I think I had this in both presentations, and I swear I put this in almost all of them because it means so much to me. So the therapeutic relationship, also called the therapeutic alliance, sometimes it's referred to as a verb like the therapeutic use of self. What it is this professional relationship that exists between you and your client, right? And it's the quality of it that matters, because through this relationship, what we can build with this relationship is so much opportunity. And in the context of conflict resolution, if we can create this quality therapeutic relationship, it can foster trust, connection, and successful resolutions. And no matter if it's a short relationship or a longer term one, because I know we all work in different roles with different types of clients. So I have some things here that are listed as quality characteristics of creating this quality therapeutic alliance. A lot of them I've talked about already: empathy, listening, respect, reliability and consistency, being authentic, open, honest, assertive, showing non-judgment. And I also love this word or term. It's called showing unconditional positive regard. If you feel the urge to look that one up, I would encourage you to do so. I love that term. It comes out of like humanistic psychology. And it's just the idea of showing another person that you hear and accept them for who they are unconditionally, no matter what it is. It doesn't mean that you're saying, oh yeah, I think that's a great idea, you should keep doing that if it's something that's harmful. It doesn't mean going along with someone or agreeing with it. It means that no matter what you do or what you say, I will still have positive regard for you and I will not judge you. And this means so much in all relationships, but it can be so impactful in the therapeutic relationship too, because often, you know, people and clients, especially trauma ones, right, have been subjected to judgment and shame. And having a safe place with the safe person, even for a short period of time, can promote growth and change. And we know this because there is research and evidence to prove it. This part I love the most. So what data research shows us is that not only does this alliance, this relationship, help foster growth, change, help resolve things, but it also has been shown to predict treatment compliance and treatment outcomes across a range of client or patient diagnoses and across a range of different treatment settings. And it's shown to be one of the very strongest predictors of successful treatment. That's huge to me. Like, just what we can do to foster empathy, connection, growth, non-judgment in a relationship, a professional clinical relationship with our client can lead to these things. So I think that's awesome. It's worth including. And let's see, with that, I'm just going to bring us to questions, and I don't see any right now in the Q&A box. I don't think I missed any in the chat either, but I'm happy to be here and answer anything that anyone might have regarding, the previous seminar or this one. Do you want, I'm open to comments as well. I'm not sure if Maureen or if June, if you have any preference on these last couple minutes or anything you'd like me to speak to, or anything that I maybe missed in the last one. I guess since there's no questions in there right now, I will tell you all one thing, which is those additional handouts that I spoke about in the complex trauma seminar, I emailed to the people in charge over at CMSA New England, so they have them and you can distribute them however you feel appropriate. I have a comment here, excellent presentation, of course. Yeah, thank you. Well, let me say this. Thank you again for having me here. Honestly, I hope it comes through. There's nothing that's more meaningful to me than talking about these things. I think this is kind of what life is about, what it means not only to be human, but also in the helping fields. Like, this is what it means to help people walk these paths in life and help them, grow and change and, do those things that we want to see for them and kind of make the world a better place and all. So again, I go back to my favorite quote, which is from Carl Jung, the psychologist: "Until you make the unconscious conscious, it will direct your life and you will call it fate." And again, speaking to this, like, I hope today I could make some things conscious for you, meaning bringing them into your awareness, or maybe give you a review or some new information that empowers you to have a better understanding of things and make changes. And then you can share that with other people to help make the unconscious conscious for them as well. So that's always my goal. And I hope that we achieve that in some way. I just see a lot of very kind comments. Thank you, you guys. I appreciate that feedback, and any feedback on the evaluations. I'm sure they're anonymous. I appreciate any constructive criticism and feedback as well. It helps me be a better presenter. So again, thank you for having me here today. And I guess if there's no other questions that come up, I'm just going to kind of turn it back over to you guys and let me know what you'd like to do from here.